Dr. Anne Ramoyne. Oh, great, perfect. So hi, I'm Dr. Anne Ramoyne, and I'm a professor of epidemiology at the UCLA Fielding School of Public Health, and I'm also the director of the Center for Global and Immigrant Health. The center is responsible for the Global Health Certificate, and so the meeting today is specifically to give students an understanding of the Global Health Certificate. So I will go through just a short PowerPoint presentation about the Global Health Certificate, what you need to do to be able to obtain the certificate, and then we'll just leave it open for questions and discussion at the end as needed. This session is going to be recorded and available online, so should anybody miss information or not be able to stay for the full presentation, we should be able to have the information available, and you can always contact us if you have additional questions as well. So with that, I am going to put this into, I guess I'm gonna share my screen so that we can get this going. Let's see here. It's been a while since I've had to put this into presenter view since I'm on sabbatical this quarter. I'm not always fully okay. Here we go. Let's see. Been a long time since I've done this. Okay, hold on a second. Let me, saying PowerPoint wants to use my microphone. Do I put it into present? Cindy, remind me how I put this back into it's been
Oh yeah,
no worries. So I think I share my screen first, right?
Yes. Yeah, and then a little window will pop up and you just click which screen or which file you want to share.
Right. And then
you just
sharing this. And then within that, then do I put it? I think I put it in presenter mode.
Yes. Yep.
Ta-da! Okay,
Perfect.
I got it. It's what happens when you get out of practice for a short period of time, and then all of a sudden it's like impossible to be able to do. Okay, I got it. So here we are. As I said, I'm Dr. Anne Ramoyne. I'm the director of the Center for Global and Immigrant Health. We also have Dr. Adva Godot, who is also on faculty in the Epi department and assisting with the center. We also have Kirsten Chickering, who is on staff, and Cindy Beard, who is a doctoral student who is also helping out with the center. So it's nice to have you all here. We have really great attendance. It's great. And so let's just dive right in and get started. Okay, so this is the Center for Global and Immigrant Health and the certificate in global health. So always good to go over what do we mean by global health. Global health used to just mean international health. It used to be what we considered to be work just being done places that were not here. But today, of course, we want to make it really clear that global health is collaborative, it's interdisciplinary, and transnational, that the issues transcend national borders and governments and impact population health. And as you know, we say global health can be done locally here, and global health can be done elsewhere. But global is local and local is global. So really, global health is about an approach that transcends borders and impacts everyone. We're also talking about immigrant health here in the center. And certainly immigrant health is a component of global health. We have issues that face migrant and other underserved populations. And certainly work for the Global Health Certificate could include immigrant and refugee populations here in the United States. And we're really open to that as well. The Center for Global and Immigrant Health that sponsors this certificate was established in 2008, and we are charged with organizing the Global Health Certificate. And the CGIH includes faculty from many departments here at the Fielding School of Public Health, as well as from schools of medicine and dentistry and nursing. Faculty are involved who are interested in global health and collaborating on global health, teaching global health. And here at UCLA, we have a lot of global health work ongoing. We have a lot of work here locally, but we also have work in more than 50 countries throughout the world. So, you know, the UCLA global health reach, in particular at the Fielding School, but also throughout the campus is really quite wide and large. Okay, so everybody's here today to talk really about the Global Health Certificate. And so I just want to give an overview very quickly about what the requirements are, what this looks like. So the Global Health Certificate is something that we've been issuing for many years. It's really important because some people have asked before, is this something that could be on my transcript? And the answer is no. Certificates are actually not printed on your transcript, but we will provide you with a certificate of completion that you can share with employers, or if you're applying for another a degree program or something else, you will have documentation that you have completed the Global Health Certificate. It's 16 units of global health coursework, and we have a pre-approved list of electives on the CGIH website, which you can go to. And we also understand that there have been, in particular in the last couple of years and with COVID, there have been a lot of issues with being able to get all of the courses. So if courses are not being offered, or if there's an issue or you really want to substitute the course, you can certainly ask for a petition to change the elective requirement with a justification. Just send it to us and we will consider it. We're pretty flexible on this, so as long as it really does meet the requirements for global health, you should be able to get that done. Cindy has just pasted the website that has the updated list of required required courses and the courses that can count as an elective. The other major component of the Global Health Certificate is an experience, fieldwork experience. And that should be a 10-week experience with a paper. Students should submit their prospective internship interest form to CGIH, so we can make sure that your internship fits the requirements and that you could use it. There have been a lot of questions already this year about what's going to happen with global health certificates, not the certificates, but with travel and global health internships, and we're not sure yet. We'll go over that a little bit more in a few minutes, but just so you know, that's something that we'll cover. The other thing that we need is a completion of the certification from the Collaborative Institutional Training Initiatives. It's city training, so that's ethics training. You're going to need that if you're going to work on any project that requires IRB approval. So it's a good thing to have. We require you to get it. We expect people to attend 2 global health seminars. They don't have to be in person, they can be online. And then you have a 5-page capstone paper. So I'm just going to go through in detail what these things are. So as I mentioned, we have some coursework requirements. We require CHS 200, HPM 240, or EPI 420. These are 4 units courses, 4-unit courses. EPI 420 actually will be offered in the spring this year. So that's one course that you can take. That's my course. It will be offered this coming spring. And so it is something that can be used to meet the requirements. And if some of the other classes are not being taught, we can come up with a list of approved elective courses. Then you have 12 additional units, which are 3 additional courses in global health. And you can submit a petition form if you want to use another course. So EPI 420, just for those who are interested, is offered in the spring. So you'll be able to sign up for that during when courses are available for winter term, for spring term. Okay, for the field work. So the field work has to be done while you're enrolled as a grad student at UCLA, and it should be for at least 400 hours. This is really the your 400 project for most of you in here are master's students, I see, and so your 400 project should count for this. And you just want to make sure that what you're doing actually fits under the context of global health. And that's why we just recommend that those of you who are getting the certificate, when you're planning your internship, excuse me, it's a good idea to check in with us and just make sure that what you're doing is going to fit in. For FSPH students, because most of you are FSPH students, although some of you are not, you want to make sure that your 400 course paper is sufficient, but for non-FSPH students, you should put together a 5-page analytical paper or something else that's done through a 596 independent study course related to your fieldwork experience. And we can help you sort that out as time goes on. So if you have questions, please do reach out to us. We'll be able to assist. In terms of funding, we don't really know what the situation is going to be this year. In the past, there have been a lot of funding for global health internships. And so I think that, this is something that we'll have to be watching as time goes on. Certainly the definition of a fieldwork experience and whether you're working remotely or in person is all very flexible during the COVID era. And in the winter term, Dr. Tavro and I will also likely be hosting an event to be able to discuss funding for internships, in particular global health internships. And at that point, we should have a little bit more information on where things stand, what's going to be allowed from a UCLA perspective, and what students can be looking for. But as we've all learned during this COVID era, we all need to be flexible and coming up with multiple options, and we will certainly be accommodating. Let's see. Let's see, there's here we go, finding an internship. So internships, students finding an internship. So students are responsible for finding and securing their own internship opportunities. And you should really be talking to your advisor, your peers, the person responsible in your department for practice will be very helpful. We also suggest if you are in a class or in a seminar where you have a speaker that is interesting or doing things that you're interested in doing, you shouldn't be shy. Ask if there's an internship opportunity. I mean, I think that it's really important for everybody to just come up with options, be proactive, talk to people who may be working in the area that you're interested in. And I think a lot of opportunities come from that kind of proactive stance. The key is that you should find an opportunity that allows you to develop, one of these global health competencies. And I believe, Cindy, maybe you can put a link to those global health competencies as well. Since I think I can't quite share that, but there's a list of global health competencies. We also on our website have a YouTube video of the last year's international internship meeting. And so if you're interested in getting a jump start on this or really understanding what's out there, what you can be doing, you can always watch that. It's archived, it's available. And we're certainly going to start coming up with suggestions of organizations that you can look into. The CGIH website does have a lot of this information. And when you do have an opportunity, just be sure to submit that internship form to CGIH for feedback, and we'll be able to, help you navigate. So this is just a little example of what the form looks like. Really straightforward, really easy to put together, and just make sure that you fill it out or reach out to us, if you have any questions or issues. Okay, so the city certificate completion. If you are, check with your department which one is going to be more relevant to you, either the biomedical researchers and staff or the social and behavioral researchers and staff. The website is also here. Cindy will also put the website in the chat, so you can just click on it. I always find it's easier for people when they can just click on things. But you should submit the form of the completion certificate so that we can check that off against the certificate. Make sure you have everything you need. Okay, Global Health Center seminars. This is another thing. So we really reduced the number of seminars that we required students to attend, and made it such that you can do these remotely now. Now we're used to this with COVID, and really understand the benefit of all of these online seminars. So we want to make sure that that you need to attend. I believe it's 2 global health seminars. Cindy, is it only 2?
Yep, it's only 2 for the entire time at UCLA. Right.
So we've really reduced the number, but we're really trying to make this possible and COVID friendly for all of you. We understand that it's a very complicated moment to try and navigate. We really want you guys to be able to get the certificate and to get that global health experience. So you have a minimum of 2 global health seminars, but I really encourage you that you attend many global health seminars. This is the moment to do this. And because you can watch so many online, I really encourage you to do as many as you can, but you just need to submit 2 as completed for your ability to be able to get this, to get the certificate. So there's a form, and you either that you fill out, and then you either attach a screenshot of the webinar or a copy of the event registration. We've got a list here on the screen of a couple of different places where you can also be looking at seminars here at UCLA, but really, there are so many different universities, different international global organizations that are out there. So I strongly recommend that you you do as many as you can at this moment, but just submit 2 to us so you can get your certificate. And here's the form. As you can see, these things are really straightforward, so it shouldn't be complicated. And if there are questions or if there are issues, anything you need, you just let us know. Speaking of global health, lectures, the Center for Global and Immigrant Health actually sponsors a COVID Conversations lecture series. We have a lecture from someone from another, from somewhere globally, talk about what's going on with COVID and in their specific context. For the kickoff COVID conversation this fall, we have Dr. Dalu Mukadi who is a professor at the Kinshasa School of Public Health in Congo. He's a colleague of mine. We work together, and he's going to lead a very interesting discussion of what's going on in DRC and response efforts there, as well as the research that's ongoing. So I think this is a great opportunity, whether you're getting the certificate or not. I highly encourage people to attend. It'll be really interesting. So that's Tuesday, November 30th from 12 to 1 p.m. So I hope to see you all there. Okay, so the next question is, or the next requirement for the certificate is this professional reflection essay. So in addition to your 400 project, or what the requirement just for your field work, so this essay that you have to do, either through a 596 or 597 or the 400 course. We also request that you write a 5-page double-spaced paper due when you submit your global health certificate materials, and just describing the essay. Cindy or Adva, do you want to share a little bit more information on the essay?
Yes, I'll post the link in 1 second.
Yeah, I think we have instructions about the content of what the essay is supposed to cover on the website as well. So really the website is going to be a great resource to you all as you navigate each component of the requirements for the certificate. Mm-hmm. And I believe the 400 course already has an essay component to it, but this would be a separate, and Cindy, correct me if I'm mistaken, I know we changed this around last year with COVID, but I think this 5-pager is a separate sort of reflection on your time at your internship in global health or immigrant health, and sort of speaking about the skills acquired, the challenges and meaningful encounters during the internship and how they impacted your professional growth in public health. So anyway, instructions for that are absolutely on the website. You can always contact us, as Dr. Amoyne has been saying, with any specific questions about the content of your paper, what you should and should not include. And I just want to echo something Dr. Amoyne said about going to more than 2 of the seminars if possible. Highly recommend it, also because I think it's a great place for people to network and to meet potential supervisors or mentors for either your global health internship experience or future jobs. So always worthwhile going to those. And Cindy and I do our best to post on the CGIH listserv. For all of you, you should sign up for that as well. We post not only our own CGIH sponsored seminars, like the one with Dr. Dalu Mukadi that's coming up, and our COVID conversation series, but also several other departmental talks around the UCLA community that are of interest to global health workers and to people interested in global health. So we'll post things from the medicine department in school. We'll post things from demographics and from community health, all sorts of stuff there, even things from urban planning and other policy departments that are of relevance. So sign up for that listserv if possible, and we'll get information on all of those seminars as well.
Exactly. And as as both Adva and Cindy have just suggested, we have there are so many seminars, so many things ongoing. It's not just what we post. You should feel free to look out for other seminars and other opportunities. They are plentiful right now, but we will definitely post ones for people to be able to see and to attend as they come across our radar.
Exactly. And, as Dr. Amoyne mentioned earlier, you're welcome to go to seminars that are outside of UCLA or being offered online through Johns Hopkins or other universities that do a lot of these types of seminars. Just, show us proof that you attended the seminar, show us information about what you attended and when it took place and who the speaker was, and we'll be sure to count that towards your requirement.
Exactly. Great. Okay. So just a few housekeeping notes here. So for forms, students that are interested in completing the Global Health Certificate should fill out the Declaration of Intent form by week 10 of spring quarter of the first year of graduate study at UCLA. It really helps us keep you informed and to be making sure that you're meeting the milestones. It doesn't mean that if you don't fill out the form, it doesn't mean that you can't do the certificate if you've met all the requirements. It just really helps us really understand who's interested and what people's plans are. Once a student as a student, you've identified an opportunity for fieldwork, also please submit that intent form for your prospective internship so we can really review it and ensure that it also meets the requirements for the certificate. These things are not required, but they will save you some time and hassle if you know in advance if this actually fits, because we can also help you shape it and help maybe tweak it slightly so that you are able to meet those requirements. Remembering that global health really is broad these days. It isn't just about working internationally, it's about working on global health issues. A few other pieces of advice: you can tailor your current coursework to focus on global and immigrant health issues. In your classes, really thinking about global health, thinking about taking on global health topics, very, very good idea. I would definitely keep abreast of the main global health journals. Those include Lancet Global Health, WHO Bulletin, the British Medical Journal Global Health, Health Policy and Planning. There are so many global health related journals out there. Those are just a few, but really you should keep on top of the data and the publications. It's moving very fast these days, so it's also good just for being a public health professional that you should be doing this. And that's really part of this global health certificate, is just helping you think about things globally, which should help you as a global health professional in general. I would talk to other students who've already done the international internship. They always have good advice. We've put some contact info on the CGIH website as well. I think about global health beyond just these lectures. Think about skills that are going to be relevant for careers in global health: grant writing, program evaluation, data science, things that really can be utilized on a global scale. This is, for those of you who are interested in the global health certificate, we assume that you're really probably also interested in global health careers. So anything you can do to be able to further that, you should be doing. The last thing here, keep your language skills up to date. Global health really does require excellent communication skills. If you speak other languages, that's fantastic. If you don't speak another language, you can consider taking classes while you're here at UCLA. I think that that's one of the great benefits of being at such a terrific public institution here that has so many offerings. If you have the time and the inclination to brush up on language skills, it will help you communicate to other cultures, other populations. It's a really great idea. I think we've learned in the last 2 years here how important public health communication is, and being able to speak another language really goes a long way in being able to reach other populations. So I strongly recommend that. Of course, if you have questions, we have an email address. You can also email me. You can email Dr. Godot. You can email Cindy Beard as well. You should also follow us on Facebook and on Twitter. Subscribe to the YouTube page as our lecture series comes on board and for any other additional information. We really do look forward to working with you and having as many of you start and complete the Global Health Certificate as possible. I think it's really worthy, and I think that we're at a moment in time where we really all understand how important it is to think globally. So those are all the main points of the presentation. I'm now gonna stop my slide share. And now maybe we can open up for some questions. Does anybody have any questions? Anybody? Well, I think
There's one in the chat.
Go ahead.
I'll read it out loud for the person. It says, is it possible to complete both the certificate and the MPH in 1 year? I'm asking for medical students who will be enrolling in the MPH. I'm assuming you're talking about the 1 year MPH.
I mean, as long as they meet all the requirements, they, including the internship requirement, they should be able to do so.
Yeah, I think the key piece there will be taking the required number of elective credits and the required global health courses. So, you know, as Dr. Amoy mentioned, we're being pretty flexible these days, especially with COVID and changing course offerings on an annual basis in, you know, helping you count, as long as it's global health relevant or touches on a skill set that is important to global health, we're willing to work with you on counting those towards your elective credits. So I think the only issue in, you know, being in a shorter time span program would be having the time to take the necessary credit hours. Other than that, there should be no problem with that.
Exactly.
And I'll also just add, the certificate's available to any graduate student at UCLA, regardless of school or department of enrollment. So they could fulfill the other requirements for the certificate as a med student, even when they're not working on the MPH. It's just a matter of scheduling, like Agba said.
Yeah, exactly.
Mm-hmm. Other questions?
I had a quick question. If we wanted to, if we like found, for example, like a school or department internationally that we kind of thought fit our research interest and also satisfied the international field practice requirement, could we possibly get any tips on how to like set something up? Because this was my initial goal anyways, prior to learning about the certificate, to do my fieldwork study internationally. And I was wondering, I don't know, I guess networking, I'm kind of confused on how to go about it on my own. Any tips are appreciated.
So there's going to be an internship meeting in the winter term. And so I strongly recommend that you go to that. You know, one of the things about the internships is that it's really good idea to make sure that that internship or whoever you end up working with, that it fits the requirements for your 400 project, right? I mean, that's really important. But two, that you have a preceptor that's really going to do a good job and be able to provide you with the kind of experience that you want and that you need. And so I think sometimes just like, you know, you want, sometimes students on their own find really great internships with people that we've never worked with before, or organizations you haven't worked with, that people haven't worked with before, but you really want to make sure that it's very well coordinated. So, you know, if you're making connections to places that we haven't had an established internship before, or we don't, you know, you don't know if there haven't been other students who've worked with these people before, it's just a good idea to make sure that the expectations are really clear, that they can meet your 400 requirement, and that they can, you know, provide you with a good experience. You know, accepting interns is something that can be really beneficial to an organization, but it can also be a real drain on time and resources, because there has to be somebody that's going to be able to provide you with mentorship and time and projects. And I think sometimes people say, oh yeah, sure, I need an intern, come work with us. And then they're not really able to delegate to you something that's going to be really useful, and may not actually have the time. So you just, if it's absolutely fine to be working in a new situation in a place that people haven't worked before, and to make those connections, but you just want to make sure that it's structured well and that you work well with the 400 project coordinator in your department to make sure that this is going to be something that's going to fit all of your criteria. And then also make sure with us in terms of just ideas of how you reach out or make those connections. It's sending emails and requesting meetings with people is always a good way to start. So and being really clear about what you're interested in and what you'd like to propose.
I would also add to that, looking for online lectures that perhaps someone at that institution that you're interested in working with is giving, even if it's not your intended or hopeful internship advisor, is really a nice doorway in. So, scoop up and go attend as many of those types of online courses and seminars as you can. That can be a good en route to meeting people at the institution and to starting some networking opportunities. Cold emailing totally works a lot of times. And in fact, I think a lot of people are really impressed with someone who shows, initiative and interest without any specific job or internship as an initiative. So that works well as well. And then finally, I would say, speak to other people in your department who might be working in the same region or the same country. And they might, even if they don't work directly with whatever institution you're interested in working with, they might have colleagues or friends in the global health field who, they can help you establish connections through. So a lot of it is the, 6 degrees of separation, finding people who know, and working your way till you can get that connection you're hoping for.
Yep, exactly. But also you should definitely talk to your mentor, whoever your faculty advisor is. And then again, there are resources in every department for internships. So I would definitely reach out and make sure you have an idea of what you're, that you're doing this in a way that's effective, and that you're asking the right questions and asking for the right kind of internship. Other questions? All right. Well, it's pretty straightforward. This is a this is meant to be a way that we really get students interested and involved in global health. We're here if you have questions. We really look forward to seeing you participate in the Global Health Certificate. Again, I encourage all of you to attend the seminar on November 30th. We'll make sure to send this out by email and post it on the CGIH website. I thank you all for your interest in global health. Looking forward to getting to know all of you throughout the course of your career here at UCLA. So thank you so much.
Thank you.
Thank you.
Thank you.